Hi, my dear listeners. Welcome here to a brand new episode. My name is Dr. Faith Elizabeth Nanyonga, and I'm the host of the Firm Solution podcast. In today's episode, I'm speaking to Dr. Moses Kakanga, who is the Chief Scientific Officer for RECORNEA, and he will be telling us about his academic journey, what has led him to where he is, how he chose to pursue a career outside academia, and all the things that he's doing. But before we get into this, here's an advert from our sponsor, Anchor. Hi Moses, welcome to this episode. We're so excited to hear from you. Could you tell us about your career journey and what has led you to where you are?
Kakanga Moses, currently working as the Chief Science Officer of RECORNEA PTE, an ophthalmology startup developing implants for treating corneal diseases. I'm originally from Uganda, Entebbe specifically, where I studied undergraduate and did a degree in biomedical laboratory sciences before joining Uganda Virus Institute, Rakai Health Sciences Program as a laboratory technologist. Talking about the events that brought me to where I am right now, I would say that I received a lot of mentorship from the people around me. Most specifically, I look up to my father, who was a physician in the Uganda public health system for years. So that was one of my first inspiration to pursue a career in science. And this pushed me to study biomedical sciences, although initially I had wanted to study medicine, which I didn't go into. Then after that, I joined a career in laboratory sciences, where I was pushed to a quest of more knowledge in biomedical sciences, and I applied to several universities. Then I ended up doing a master's degree in structural biology at the University of London. Then through that further education, I gained the quest of pursuing a PhD, and I went on to do a PhD in biochemistry at the National University of Singapore, which led me to working on a project where we were able to patent our lab findings, and this pushed me to pursue a role in working for a startup as a product development scientist and currently as a chief science officer.
What have been some of the lessons that you've learned along your career path that have helped you get to where you are right now? And what advice would you give someone who is starting out their PhD quest or doing their PhD?
What I have learned along my career path that pursuing a career in science needs a lot of patience and persistence and hard work. Looking back all through my career, I would say that I've had to put in a lot of time and effort in order to pursue a career in science, which is not easy. And looking back at my initial quests of pursuing further education, I needed to do a lot of searching for PhD opportunities, which led me to apply to several universities after several applications. And also what I've learned along my career is that networking is a very good strategy if you want to get jobs or prospects in a biomedical field. And attending conferences, both during your PhD or other opportunities that arise during work, to attend conferences is a very good avenue to interact with leading scientists and potential employers. And in these conferences and meetings, you get an opportunity to share ideas and in return with potential employers. So those are some of the key things I've learned during my career path. What I would advise someone seeking to advance their career by pursuing a PhD is that pursuing a PhD trains you for a number of future career roles. I would say gone are the days when people thought of doing a PhD only to remain in academia. So originally, PhD 101 was after doing a PhD, you would pursue a postdoc in the line of becoming an assistant professor to a path of becoming a full professor. But now there are other available roles PhD graduates can pursue. For example, working in industry as scientists, working as a regulatory medical device and biopharma regulatory officers, working as medical liaison officers, and some as writers for leading journals. So I would say that going to graduate school to pursue a PhD, mainly in biomedical science, is not an easy feat. And if one decides to pursue a PhD, it should be ready to persevere through the journey of doing a PhD. Because most of the times things don't work out as you expect. Like from the start, whatever you start with as your main topic might end up changing and you totally finalize with something else. So you have to have the spirit of starting all over again if things don't work out.
Given that you are an international student, what advice could you give a person who is looking out for PhD supervisors, PhD scholarships, and trying to figure out exactly what PhD to do?
You have to look at the area you're in. For example, let me say if you're in the field of immunology and you're looking to study immunology, I would advise to look for professors who are doing research in the area they want, and also do a background investigation about these professors to see whether you'll be able to work in this lab during your PhD time. Sometimes, like in some places, let's say the US, Asia, where PhD is about 4 years, choosing a professor whose advisory style does not blend with your work plan might affect your progress. And sometimes it leads to people dropping out of their PhDs. So you can do this search by looking at the websites of these professors. You could even go ahead and send some emails at some of the lab members asking them that you'd like to join that lab. They would give you like a background about the professor and how he supervises, so that you don't go into a place where you're going to be challenged by the working conditions of the lab.
Could you tell us about your experience as a PhD student? What was it like?
I would say during my PhD, my experience was that at the beginning of it all, I came with a lot of excitement joining a lab. During my PhD, I changed from one supervisor to another. The reason being that the supervisor I chose to work with first, our working relationship didn't blend. I ended up asking to change to another supervisor and another topic after my first semester. So those are some of the challenges you can face in order to persevere with these challenges during the PhD. You can always share with your fellow PhD student to get advice. And also another thing during your PhD, it's always good to communicate with your PhD advisory board allocated to you. Assist your professor to see that the progress of your PhD is in line with the guidelines of the university. So in case you get any challenge, you can reach out to them.
How has been your life like after the PhD? And how did you come to a conclusion that you aren't going to pursue academia and that you'd go on to do biopharma and translational research? Could you give us a glimpse of what led to this decision? Also, what advice could you give a person who is finishing up their PhD and thinking of what direction to go? Because some people think after PhD, all you have to do is be in academia and take the tenure that leads you to become a professor.
Life after PhD, I was not so enthusiastic to remain in academia because during my PhD, as I said earlier, that I worked on a patented discovery where we were developing biosensors that could be applied in screening anti-cancer drugs. I picked up interest of working in industry or biomedical technology startup where I would help to bring ideas from the lab to the bench. So after my PhD, I immediately joined an incubator where a group of PhD graduates were congregated so that they can interact, to network, to develop ideas that can be translated into tangible medical products. So that's where I met colleagues I'm working right now. So one of them had several patented products. One of the patented products was an implant for reforming deformed corneas. That is what we are working on right now. And basically my role is to analyze the science behind the products and also advise on product improvement. I'm also in charge of writing protocols, clinical trial protocols for the devices. So I would say it is a little bit away from the lab, but I'm still continuing reading scientific papers. So literally, it's almost the same thing. I read scientific papers and advise on product improvement. So currently, I'm still in this role, seeing that we bring this product from the bench through clinical trials, licensing, and finally to the market. Then after this, I'll reevaluate myself if I want to still work for a startup or if I want to move on to work for a bigger multinational biotechnology company. I would say that there are a lot of options for biomedical technology PhD graduates, and you shouldn't limit yourself or put yourself in a box that you want to stay in academia, because also pursuing a postdoc can be an endless pursuit from one postdoc to another postdoc. Also, for some of us who move, like let's say from Africa and go and study overseas, most of the times also it's good to set out your plan after to go anywhere in the world to further develop your scientific career. Armed with a PhD, the world is your playing ground and you could work in any field, starting with what you specialized in and also pursue other careers that are not limited with what you studied.
Considering that you're far away from home and you're in a different country, could you tell us about your emotional experience? How was your emotional experience while you're pursuing a PhD?
My emotional journey while pursuing a PhD, I would say it was tough. I had a lot of excitement, but going into doing the real PhD, that's where the real things kicked in. I realized that things aren't easy as I expected, and I needed to refocus. As I said, one of the key defining moments during my PhD was that I changed supervisors. That decreased on the time I needed to finish my PhD. So I had to squeeze all my work in 3.5 years, which was tough. I could stay long hours in the lab, which sometimes also affects your sleeping hours. So kind of affected my everyday life, but I was able to persevere till the end. And finally, I was able to defend my PhD in 3.5.
It's amazing. Did you face any challenges during this journey? If so, what were they? If not, how did you make it through?
I would say challenges, not so many, apart from changing supervisors. The lab I changed to, I had a very good working relationship with other lab mates because it was an international lab with people from everywhere. I didn't face many challenges, but I would say as expected in all PhDs, you could expect failure of experiments and repeating them. So that was one of the big frustrations. Experiments fail and you repeat them until you get the most fulfilling results to contribute to you finally writing the thesis.
Hey, before we finalize this episode, I would like to invite you into my Facebook group. The name is The Firm Solutions - Advance Yourself. And you can find the details in the show notes of this episode. Every Monday, I get into there through a live session and I teach you everything about career development and career growth, about how to write resumes, how to network like a pro, how to take charge of your career and the like. So if you'd like to learn and get the free resources that I have, please join the group and I'm excited to see you there. Let's meet on Monday at 9 p.m. Australian Eastern Standard Time. See you there. What were some of the lessons you learned along your PhD journey?
The lessons I learned during my PhD journey was that when you're building a scientific career or when you're doing graduate school, no scientist is an island. Having a successful career in science, it's a collaborative effort. Collaborate with a lot of people. I learned that all the people who are working in your lab, it's always good to collaborate with them in case, let's say, you don't have your primers are running out. You could ask another person. Okay. If your supplies are running short, if you have a very good collaborating relationship with your colleagues in the lab or the neighboring lab, can always be bailed out. Your experiments are completed on time.
So did you have any role models or any mentors along this PhD journey?
Yeah, I had role models. One of my role models, I would say, is my former supervisor at Rakai Health Sciences Program. He's called Steve Reynolds. He was the head of the NIH Center of Excellence, who actually recommended me for my PhD. I used to seek a lot of counsel from him during my PhD journey. PhD supervisor. He was a very good mentor. His supervision would push you to do independent research. He wouldn't give you like a schedule for work. He just tell you, even though you come anytime you want, provided that you do work and present in meetings and be able to get results to write papers and the results you put in your thesis, which was, I would say it had two coins of it, good and bad. Because you would end up like relaxing and not finishing up all the experiments. But in that case, I was able to define my own schedule. Where I would go in and do experiments, finish them. If I want to go during the weekend, I skip a Monday. So I had a lot of space to do independent work.
That's good to hear, because I think that's a good way for you to learn. If someone lets you do things and you report to them, they're not micromanaging you. It gives you the time to think as an independent researcher. So it also gives you some kind of responsibility, because if your supervisor has to keep on following you every day, asking you, did you do the work? Did you produce the results? Do you have what I need? It kind of becomes a bit hard. Yeah.
I don't know whether you also realize that depending on where your supervisor studied from, they have different supervision styles.
Yes.
So like, let's say people who are studied, let's say from Europe, and studied in the US, and studied in Asia, have different supervision styles.
That's true. That's very true. So if someone is starting out to look for a PhD, what is some of the things that they should look out for when they're starting their PhD journey? Given that you've gone through the system and you exactly know what it is to do a PhD, especially give us an insight of how to do a PhD is in Singapore, because I think it's different from what we do here in Australia or elsewhere around the world.
I would say during the application process, it was good to do an investigation to see which lab you're going to apply to and which professor you're going to work for. And if this falls in line in what you are interested in. So for my case, I did my PhD in Singapore. The way their PhD formats are that you have to do classes at the first 2 years at the same time work before you do your PhD qualifying exams. Depending on what you want, you can decide to do it in 1 year. 1 year, I'm going to do only credits and I'm going to do minimal lab work. Clear the credits, then you concentrate on the lab work. You can do that, but most of the times since they also think the university thinks you're doing research, you have to do, they call them the advisory meeting, where you're supposed to give the progress of your research. So in that case, is that if you choose to do credits in 1 year and you're not doing any lab work, your progress assessment might not be good and might end up either telling you to leave the program or to increase like by 1 semester. But sometimes if you decide to do this, your supervisor can vouch for you. Most of the times, actually, if you have a good working relationship with your supervisor can make or break your PhD. Your supervisor could say that, this student is going to do all the courses and clear them in 1 year and do lab work later. So if we can write a letter for you to your university, that can help.
Okay.
Yeah.
Okay, so it's different from Australia. Here we didn't have to do any courses. You just come into your PhD and you start your lab work. Of course, there are some trainings that you get, like let's say training you how to write scientifically if you're doing science, how to present, like career development framework courses. But we didn't have to do any courses in terms of going back to study.
I would say actually that is good, because actually we had all those arguments and we are saying that since someone has gone through a master's degree, there is no need for this person to do like courses again. As you've said, these career building workshops and other trainings on presentation, writing scientific papers, maybe even entrepreneurship in place of doing classes.
Okay. The other question I would want to ask you is, you talked about networking as a PhD student.
Yeah.
When you joined the PhD, did you have your mind made up about what you'll do at the end of the PhD, or it evolved around time? Tell us about how you decided that you wouldn't do postdoc, you'd go into translational research. Yeah.
When I joined the PhD, actually, my future career plan was to remain in academia, to do a postdoc, or go back and do work as a researcher in the lab. But during my PhD, my future goals, as I said, as a result of what I was working on, I decided to look at other options or bring ideas from that bench.
For everyone joining a PhD, it's better to keep your options open because you don't know where your journey will take you. Some people get into it and they're thinking, oh, when I finish, I'll be a professor. But when you finish your PhD, you'll find that probably that's not the direction you want to take. You want to take something else. So it's better to have at least an open mind. I want to ask you, how did you find out about this startup that you talked about? How did you get to know that you could take this option of getting into the lab but doing something translational?
How I got to know about it, the research center I was working in, Singapore is trying to build like a mini Silicon Valley where different research institutes collaborate. So it's called the Agents of Science, Technology and Research. And there used to be a lot of workshops on entrepreneurship.
Okay.
And different incubators would come and present. So one time I went for a presentation by an incubator. They're originally from the UK, called Entrepreneur First. So they were looking for people who did PhDs and had prospects of joining incubators to bring ideas from the bench to the lab. So that's why I picked their interests and joined. In that case, actually, I wasn't expecting that much. I was like, if this doesn't work out, because I had other options of applying for postdocs, right? I was like, if this doesn't work out, maybe I might apply and go and do a postdoc. But thank God it worked out.
Okay.
And that's what we are pursuing right now. And the person heading the startup was able to write a grant, and we won a Euro grant, which we are working with right now. Facilitate our clinical trials. Actually, we've just gotten back our grant review.
Okay.
And given us a go-ahead to continue with development.
So how did the PhD prepare you for this current job?
I would say the PhD prepared me for this current job as I got a lot of training in how to complete assignments during my PhD and also analyzing research papers and to siphon out the best ideas to move on. Most of the ideas that come up right now in the company, the things I picked from my PhD that are helping me in my current role. Though I don't do any lab work anymore.
So where do you see yourself in, let's say, 5 years from now?
5 years from now, I see myself being a chief science officer for a big multinational biotechnology company or biopharma. I would also see myself as in a role of medical device development, advising, because during this role I've learned a lot on how the life cycle of medical device development works, from looking for ideas through unmet clinical needs, patenting them, doing R&D, testing prototypes, or conducting clinical trials and certification. So I see myself still in biotech and medical tech development, but on a higher level.
Amazing. That's good. That's very good. And did you have to do any other courses after your PhD, or it's just your PhD that you're now putting to use?
So actually during my PhD, I did like some online courses as well, although it was a tough schedule. I did an online course, a certificate, an introduction to patenting and copywriting in biotechnology.
Oh, amazing.
Yes. That certificate was offered by WIPO, World Intellectual Property Organization. Yeah, they actually, WIPO, if you're interested in joining patenting or be a patent attorney, because they recruit PhDs.
Okay.
If you have a PhD, you can actually also look for those roles. I forgot to talk about them. They recruit PhDs and they train you to become a patent lawyer. So a patent attorney in the field of biotech and biopharma. So WIPO has joint courses. There is actually, they have a joint course with a university in Australia. Is it the Queensland University of Technology?
Queensland University, QUT, yeah. Okay, that's good.
They have a master's and it's free if you apply.
Okay.
Yeah. They also have another master's with a university in the UK. Yeah, so you apply and if you get in, they fund you for free.
That's good. That's good information. Okay.
Yeah, so I did that course and I also did I did another certificate in medical device regulatory.
Okay.
But it wasn't like for the patenting certificate was, I think, 5 months. Then the other certificate was about these short, small certificates. I think it was maybe 2 weeks. Yeah. So it's always also to see if you want to change course into working for other fields apart from working in the lab. You can also look at the option of doing these other small courses.
Okay, that's good information. That's very good information. It's amazing to see where a PhD can take you when you do it. Like a postdoc is not set in stone. Many people are going on to do different things with their PhD knowledge, because from a PhD you gain a lot of skills that can be transferred to other fields.
Yeah.
That's so lovely for you to tell us that. So we've talked about all these things. What's the last piece of advice you'd give a person who is now in their PhD and they're thinking of what they need to do to get it done?
The advice I would give a person pursuing a PhD right now and wants to get it done, I would say is that I wouldn't say that putting in more time, but time is needed.
Yeah.
But I would say always look at the most important aspects of the questions you want to answer.
Yeah.
And go deeper into them and focus.
Okay.
And the advice I would say that most of the times it's what I learned during my PhD that I can advise is that always be willing to change. If something is not working, how can you tweak it to work? Okay. And also the mantra I always used during my PhD was that having the ability of starting all over again when an experiment doesn't work. If you're cloning and your cloning doesn't work, you can always start all over again. If you're doing your PCR and the primers you designed didn't work, redesign the primers to change the targets. In the end, things always work out. Okay. And also they shouldn't shy away for asking for help. Okay. Because sometimes the PhD journey might be stressing and can make people to fall into depression. Okay. So always be willing to ask for help.
Okay, that sounds good. That's actually very true. Be ready, be agile, be ready to change, and look for help. Amazing. So it's been lovely talking to you today. Thank you so much for letting us get into your life and understand how your academic journey has been. Before we sign out, I have some few questions I need to ask you. They're called quick fire questions. I just need a short answer and we are good to go.
Yes.
What's your best food?
My best food is green peas and rice.
Amazing. That's such a simple meal. That's lovely. That's lovely to hear. Oh, okay.
That is my best food when I was in Uganda. I liked peas a lot, and rice. Yes, the combination, but all the other local food like maize flour.
Okay, that sounds good. That's good. So the next question is, what do you like to do in your free time?
During my free time, I like watching movies and also visiting art galleries. Okay. Where would people find you if they want to connect with you? If people want to connect with me, they can. On my socials, I use Dr. Kakanga on Instagram, the website of our company called RECORNEA. Since we are working on the cornea, so we want to reconfigure it to its normal physiological state. And I'm also on LinkedIn. My name is Kakanga Moses. Okay, right. I'll be sure to put all the details in the show notes of this episode, and I'll also link you. Okay, thank you so much for your time. Thank you so much for taking time off your busy schedule to talk to me. It's been a pleasure, and I've learned a lot from this episode. I wish you the very best. Thank you so much for tuning in, and thank you so much for taking your time to listen to this entire episode. So I'd like to end this episode here, and if you've learned something from this episode, please subscribe, rate and review wherever you listen to your podcast. And if you have any guests that you'd like me to interview, please send me an email. The email address is theframesolution@gmail.com, or you could use faithliz@theframesolutions.com. Follow us on the socials, which is Instagram, Facebook, Twitter. The name is The Frame Solutions. If you're enjoying and learning from these episodes, please share them with your family, friends, your colleagues, and everyone who is interested in career development. I can't wait to speak to you in the next episode.